Good evening, I'm Renetta Dubose, and thanks for joining us for News Channel 6 at 11. We begin with PCOS. It affects 15% of women in the U.S. and many go undiagnosed. Some women take as many as 10 pills a day to treat the genetic, hormone, metabolic, and reproductive disorder. But one organization brought together several patients to talk with the FDA about the need for an official PCOS drug.
It started at age 15. Facial hair.
I ended up getting diagnosed at 22 after having bled for 40 days.
One by one, women battling PCOS shared lived experiences.
I wake up basically every single day of my life exhausted.
From issues with being heard by doctors to the challenges of treating their polycystic ovary syndrome, these women, representing the 15% of them affected across the U.S. by the disorder, were heard.
Most patients are taking multiple drugs to treat multiple symptoms, and there's a lot of trial and error around trying to manage the condition.
Sasha Ati runs PCOS Challenge, the National Polycystic Ovary Syndrome Association. The organization held the first of its kind patient-focused drug development meeting at University of Maryland. The gathering gave members from the U.S. Food and Drug Administration a chance to hear how medicine specific for the genetic, hormone, metabolic, and reproductive disorder could be life-saving.
I struggle every day with anxiety, depression, and eating disorder. A drug that would address the underlying cause of PCOS and alleviate some of those comorbidities and the symptoms that I live with and struggle with every day would be incredible.
I learned I had diabetes, and I started learning about PCOS, and then I learned I had endometrial cancer as a result of PCOS.
Patient advocates Shelby Goodrich-Eckert and Jennifer Gutke joined other women on panels and in large discussion groups during the more than 4-hour meeting. Women stressed how managing their PCOS with off-label drugs, as many as 10 pills twice a day, isn't working.
It's incredibly frustrating that we don't know the root cause. We don't know the genetics behind it. We need treatments curtailed to treating our disorder, not treating the symptoms that arise because of it.
Patients also took polls, shedding light on how everything from weight gain to infertility and depression can impact their daily lives.
Patients with PCOS have so many multiple issues because they can probably be fixed on a treatment for one single thing, but there's no one single thing.
They want specific options for PCOS. To help them manage the condition better and prevent some of the comorbidities such as diabetes, endometrial cancer, infertility, heart health issues, maternal health issues, all of those that are connected to PCOS.